Hi everyone, this is Dr. David Pham. I wanted to go over some important instructions after your surgery. This goes over everything that we have on the post-op sheet, but we also wanted to have a video for people who would prefer to listen or watch instead. So let's get started. After your surgery, it's really important to get some rest. So that means either time off from work, at least 2 to 3 days. So hopefully you have the weekend to relax a little bit and to take it easy. If you do have to go to work, instead of heavy lifting, then try to avoid too much lifting. Do a little bit of office work or desk work instead. And it's also possible that you might want to avoid any sort of speaking too frequently. So if your job relies on you speaking quite a bit, it might be uncomfortable just because you might still feel the soreness from after the surgery. After your surgery, we do give you an ice pack that you can take home. Please do not use it for any drinks, just because we just want you to focus on using the ice pack. Throw it away after you're done. The ice pack is good for only the first day that we have the surgery. So apply the ice on for 10 minutes on, 10 minutes off for the next 30 to 60 minutes. That will help a lot with the swelling that might develop. If you do notice the swelling anywhere, that is still normal. You might notice some bruising as well, and with the bruising, it will go away after 4 to 5 days, and it gets better with every day. The same with the swelling. By the 4th day, it will start to get a lot better, and it should not be getting worse after that. If it does, please let us know so that way we can intervene and see if we need to make any adjustments. With the pain medication and antibiotic, if we had given you one, please take it as we directed on the day of the surgery. It is important that if we give you an antibiotic that you finish the whole course of the antibiotic for 7 days, so that way we get all of the antibiotics in the system and reduces the chance of infection. For the pain, it's important to take the pain medications that we've given you. You can also, if you're able to, then you can also take Tylenol extra strength on top of the pain medication that we have given you, as long as that's okay with your pharmacist and your physician. It's important for you to take the pain medication before you start feeling pain, because then you're staying ahead of it. You don't want to get behind it, because it will take the medication in an hour for it to start working, and during that hour you might be experiencing the discomfort. In terms of brushing and flossing, it is still very important that you continue to brush and floss after the appointment. So with every day, we have to still keep the teeth clean and the gums clean. You can avoid brushing the area that we worked on the surgery for at least 3 days, or as we directed after your surgery. The main reason is because we still have to keep the rest of the mouth clean. You can brush close to that area and you can floss up to the area that we worked on, as long as you don't disturb the stitches or the gums, just because then that will compromise the healing. In terms of food, it is very important that you still stay nourished, but make sure it's soft food. So meaning, if you're going to eat a lot of vegetables, then cook them really well so they're much softer and they wash away easily. In terms of meats, then avoid anything too chewy, such as steak or chicken, and just make sure that you're able to chew it well, so that way it doesn't disturb the area. Some other foods that might be helpful would be fish, eggs, potatoes, yogurt. All those foods are much easier to eat, much softer, and they rinse away easily. We want to avoid foods that might get stuck into the area that we worked on. So that could be corn or peas and things of that nature. The last set of foods to avoid would be anything too hot, too spicy, too acidic. These foods can cause irritation to the gums and make the healing more uncomfortable. The best foods are usually cold and soft. In terms of fluids, you can drink most fluids, meaning water. Cold water is usually best. Please avoid alcohol for the next 3 to 5 days, just because it compromises the healing and makes things a little bit more dry as well. So that's increasing the risk of what we call dry socket. So we want to avoid that. Do not drink through a straw, because using a straw can actually cause a lot of negative pressure that then pulls the blood clot out of the area that's supposed to heal, and then we can get dry socket that way as well. The other reason not to drink alcohol is because it can interfere with the medications that we've given you. It is very normal to see some swelling, as we mentioned, some bruising, and also a little bit of bleeding for the next 3 to 5 days. It should start to get a lot better after each day, but the peak is actually the 3rd day, and then it starts to taper down for the rest of the week. So that means you might notice a little bit of bleeding today, tomorrow, and the day after, and it usually mixes with the saliva, and that looks like a lot of bleeding, or it's active bleeding, when in fact it's just mixing with the saliva. It could only be a drop of blood. How you would tell that it's actually a lot more bleeding would be if it was bright red, or you could taste it as well. If any of this happens, please give us a call or email us at info@arbodentalcare.com, or call us at 905-775-7377. Just in case you have any questions or concerns, please do so. Normally, we would want to check after about 10 to 14 days just to see how things are healing. If you feel like you don't need to come, let us know. But we do recommend that just in case there's anything that is healing not quite the way we would like it to. And everything will start to feel a lot more normal after about 4 weeks, and even more so after 6 to 8 weeks. Once again, if you have any questions or concerns, please email us at info@arbodentalcare.com, or call us at 905-775-7377. If there's anything that we haven't covered in this video today, please check your post-op sheet. It will give you the most up-to-date information, or even better, give us a call or email us. Hopefully this helps, and hopefully you will heal really well. We look forward to seeing you again at your post-op. Have a good one.